Taking care of a baby's hygiene can feel overwhelming, especially when it comes to delicate areas like the ears, nose, and nails. These parts are extremely sensitive, and improper cleaning can cause discomfort or even injury. In this video, we'll guide you step by step on how to clean your baby's ears, nose, and nails safely and gently. Let's start with baby ears. One of the most important things to remember is never to insert cotton swabs or any object into your baby's ear canal. The ear is self-cleaning, and wax usually moves outward naturally. To clean the ears safely, use a soft, damp washcloth. Gently wipe only the outer ear and behind the ears during bath time. Make sure the cloth is warm and well wrung out. If you notice excessive earwax, redness, or discharge, consult a pediatrician instead of trying home remedies. Next, let's talk about cleaning your baby's nose. Babies often experience nasal congestion because their nasal passages are very small. To clean the nose, start by using saline drops or saline spray specifically designed for infants. Place 1 or 2 drops in each nostril to loosen mucus. After a few seconds, use a soft rubber bulb syringe or nasal aspirator. Gently squeeze the bulb before placing it at the entrance of the nostril, then slowly release it to suction out mucus. Always clean the bulb syringe thoroughly after each use and never insert it too deeply into the nose. Now, let's move on to baby nails. Baby nails grow quickly and can be surprisingly sharp. Long nails may cause scratches on your baby's face or body. The safest time to trim nails is when your baby is asleep or calm. Use baby nail clippers or baby nail scissors with rounded edges. Hold your baby's finger gently and press the fingertip pad away from the nail to avoid cutting the skin. Trim straight across for fingernails and slightly rounded for toenails. If you're nervous about clipping, you can gently file the nails using a soft baby nail file. A few important safety tips to keep in mind. Always wash your hands before and after cleaning your baby. Use only baby-safe products and never rush the process. If your baby becomes uncomfortable or cries, take a break and try again later. Avoid using cotton swabs, sharp tools, or adult grooming products. In conclusion, cleaning your baby's ears, nose, and nails doesn't have to be stressful. With the right tools, gentle techniques, and a calm approach, you can keep your baby clean, comfortable, and safe. If you ever feel unsure or notice anything unusual, don't hesitate to reach out to your pediatrician. Thanks for watching, and don't forget to like, share, and subscribe for more baby care tips.